At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Headaches and Migraines on Wednesday, March 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live. I'm here bringing you another episode, if you will, in your throbbing head. You know, we started out last week and we got into the generalities of headache pain and so forth, but the reason I'm kind of stuck on this is because it's the number one most costly condition, period. It stops you from making money, you're staying home, you're on drugs, you're on medications, and you can't function. You know why? Because you can't think. And you get snappy around your family, you get irritated with all kinds of things. So what's a person to do? Well, you're supposed to find out what it's all about. You know, we talked about different types of headaches and irritations last time we joined each other, but we're going to get into a very specific type of headache today. We're going to talk about migraines. You know, if you remember the story that I told you last week, that how I got into doing what I'm doing was simply because of the fact that my wife suffered with migraines for quite some time. Sue was, basically devastated with migraines from the time she was about 6 years old. And they got progressively worse to the point where they wanted to fuse her neck from the second bone in her neck down to the last one, the seventh. And because she had a complete reversal of her normal curvature, and it was causing a vascular problem, i.e. a migraine. So that's the first thing that I want you to understand. What a migraine really is a vascular problem. We're going to talk a little bit about the triggering mechanisms today. We're going to talk a little bit about, what a migraine really is. We're going to see if you got one. But I want you to show up on March the 18th, right? And Dr. Qinglong Zhang and I are going to present a night on your throbbing head on headaches. You can go to drtomroselle.com. That's or you can go to rosellcare.com, ROSELLECARE, rosellcare.com. Hey, by the way, while you're there, I want to remind you that we've put up a new, if you will, site for you. You go to the top of the web page, and there's something called Ageless Health Store. If you click the Ageless Health Store, it's going to take you into a page that's you're going to look at three different things. And one of the pages that I want you to look at is something called Full Script. Many of you have asked me, what can I do to buy good quality nutritional supplementations if I'm not a patient of yours? And I said, well, you can't, but we found a way to make it happen. It's called Full Script. And you go in there and you click that site. It's a little square thing, and it says Full Script. And by the way, on it, you're going to see that there's 4 products that we're recommending to keep your immune system nice and strong. And you can get that on Full Script. So go in and hit Full Script. They just want an email address, and you can go in and you can go shopping. You can buy what you need to get. So they have some of the best products everywhere. They don't carry junk. If you have any questions, you can send me a note. I can't dose it for you because you're not my patient, but the stuff is there. The products that you're going to see there, one's a probiotic, another one's a vitamin C support, another one's another two immune supports, and some vitamin D3. I take those every day. and so does my family and most of my staff as well. And we're keeping ourselves strong so we can serve you better. Why don't you keep yourself and your family strong? Go ahead and check it out. And then, by the way, next to it, there's something called Air Tamer. Air Tamer is a filter that you can wear around your neck. It's really small. And it knocks out in the neighborhood of about 95% of all viral patterns in about 20 minutes of wearing it. So you get it on, it starts working, 20 minutes, you're good to go. And you're going to be really surprised how well, instead of these stupid masks that you're wearing, but by the way, even the N95s don't work. If you can breathe, they're not working. But you get something like this that'll kill it before it comes near. Why not use it? That's what I wore during COVID. I never had a mask on during COVID. Not at all, not once. Wouldn't do it. And, even when I was on an airplane and I flew all over the country, I had one on put below my nose, and the flight attendant came by, put it back up, and dropped it down, and I never got sick. So if you have these things available, why not? Let's get back into the program. Let's talk about migraines. It's more important anyway. So migraines, if you have a migraine, how do you know? How do you know? How do you know that you have one? How do you know that you don't have one? A migraine by definition, my friends, a migraine by definition is a vascular, any blood supply, a vascular headache. So is it because, you got bad blood? No, it's because something is causing either inflammation, which is going to cause a swelling, inflammatory reaction, which is acidic, something that is going to cause a alteration in the blood flow to the target called your brain, something of that nature. It can be caused by a shifting of the bones of your skull, which is going to alter some of those things. Now, I told you the story about my wife, and I told you what happened with her migraines and what triggered it. Sue had a reversal of the bones of her neck. So you should have a little easy C-shaped type of configuration of the neck bones. Hers were in opposition. Why? Because she always had her head down, and she was always reading, and she was always in a book. That was the nature of who this brilliant woman was her whole life. And pretty soon, this artery, blood supply, artery that goes through both sides of the bones of your neck, the vertebrae, was being restricted in its blood flow, particularly when she was under tension. She was an overachiever when it came to academics. And when she got the migraine, it was always on the weekend. Why? Because she would relax. She wasn't in class. And that blood rush to the brain with these narrowed blood vessels couldn't sustain it. So medically, what they wanted to do is they wanted to surgically put the curve back into normalcy. And obviously, what do we say? We said, I don't think so. And she went under chiropractic care for a period of time. But within 30 days, her migraines were gone. No pain. Finished. And all these years, she's never had. And she stayed under care for a period of time after that to reverse the curvature, just like you would get your teeth to line back up. You can do the same thing with a structural system of the spine. And that's what you should be doing. So, what is a migraine, right? What is it? It can be a throbbing pain. It can be a pulsing pain. It can be this nausea that occurs, this twinkle, twinkle, little light. It's called an aura. So there's, if you look at the medical literature, it says there's two types, right? There's migraine with the halo, the aura, and there's one without it. And things can trigger it like flashing lights and fluorescent lights and so forth. But this pain, this nausea, this vomiting that occurs, this knife-like pain in your eyes, you can't look at anything. So you have all these pieces. You can have things that trigger it or that it lets you know it's coming. All of a sudden there's mood changes, so there's a lot of difficulty concentrating and focusing. Would you believe even food cravings? Crazy, right? But yeah, it could very well be that type of thing. That aura pattern. Somewhere, a lot of patients will report somewhere up to even an hour prior to the headache, they start getting this visual shift, this visual change. And they may see flashing lights or bright lights or zigzag lines. It's almost like a retina's detaching, but it's not. This feeling of numbness or tingling in the hands feet too, by the way, or in the face, and then all of a sudden, boom, it hits. The headache itself, uh, you get that throbbing pain that just doesn't go away. It feels like their head is going to explode. They go to bed, curl up in a fetal position, hold their head, turn off all the lights, and don't want any stimulation, whether it's light, noise, odor, anything, because they make it worse. And then guess what relieves it for many of them? Nausea and vomiting. The end point of vomiting often just gets rid of it. But sometimes for most people, particularly if it's a structural problem, we're talking about a vascular migraine, doesn't help. And until that stress pattern, that tension, that irritation goes away, it's not going to work. So, you get into multiple pieces. What predisposes it? Well, they say it's fatigue. They can say there's shift in emotional patterns one way or other. But here's what we've experienced over 5 decades of practice. When the bones of the neck are misaligned, when the cranial plates, you got 22 bones that make up your head, are locked or jammed, that can cause enough inflammatory reaction in the blood vessels and the spinal fluid, number one. Number two, if your hormones, guys, this includes you, are off and your estrogen levels are way too high, and you don't have any buffering mechanism of progesterone, that can cause it. So if you're on different medications, hormone replacement therapies, if you're on testosterone injections and so forth, you can end up with these types of presentations. So if you know that that's a triggering mechanism, why then start taking all kinds of different medications to try to resolve and turn things around? Doesn't make sense, does it? I don't think so. And we see patient after patient coming in and said, I'm on, and then they show me the list of medications that they're taking. I said, oh my God. And then you try to find, how do you start decreasing it as you start treating them? But migraine triggers nearly 80%, and it's probably even higher than that. People who are stressed over the top will trigger migraine headaches. Why does the stress do it, you should ask? Well, I'm going to tell you why the stress might do it. Simply because of the fact that the stress now alters spinal fluid flow. The stress alters blood flow to the head. The stress level increases spikes in cortisol. That's your adrenal fight flight. All of these things can trigger migraine types of patterns. So when you're looking at the symptoms and, say, well, I just got a really bad headache. Well, maybe you do, and maybe you don't, but there are key differences. A migraine is a neurological problem, and it causes intense, generally one-sided pain, and they're devastating. A headache, just a general, run-of-the-mill headache, is usually milder, is usually shorter. It doesn't have as many clusters within it. But you have to understand what there are, and whether it's a headache or whether it's a migraine, you don't put up with it. You get it treated. You don't go and take ibuprofen by the bucket loads. You don't go have your doc give you, other types of stronger medications. You go see somebody who knows how to deal with headaches. More likely, it's called somebody who does the work that I do. And the guys that I have in our practice who are masters at getting rid of headaches. So a migraine is a neurological problem. It's intense. It's one-sided. It has twinkle, twinkle. It's called an aura. It has nausea. It has all kinds of things that you don't want to deal with. So what can help? Common headaches, they use that stupid term, which is a tension type of headache, which is usually a result of a misalignment of the bones of the neck or other parts of the body, or it's the jaw being too tight, your temporomandibular joint, that can cause side headaches. They feel like sinus headaches, but we're talking about migraines, something that can knock you out for 24 hours sometimes. The prodromal, the beginning stages, the early warning signs, if you will, are things like even mood changes. And all of a sudden your neck starts tightening up, or you start craving certain foods, or you start smelling different things, that aura that you see. And that's one of the first things is, oh my God, I'm going to have a headache. By the way, there's ocular migraines as well, where you see the aura, but thank God there's no pain, but they also cause distortion in sensory perception. So you need to get those squared away as well. We see those all the time. The headache phase of a migraine is amazing. It's intense. It's hard. Unfortunately, ladies, you suffer with these things far more than guys do. Guys will go into cluster headaches, and we'll talk about that at some point down the road as well. But that fatigue, all of a sudden you can't focus, that feeling of being off, it could be hours and even days in some situations before the migraine ends. Ends. Crazy, right? Before it ends. So if you're dealing with this kind of ongoing problem, you got to do something about it. So let's talk a little bit more about them. Migraines are neurological in origin, but they're neurological in origin that are triggered by blood supply alterations, inflammatory responses, compression on the brain because of spinal fluid not moving the way it's supposed to. Those are the 22 bones that make up your head. They're locked, they're jammed. A temporomandibular joint problem. I had a woman, and this goes back probably about 4 or 5 months ago. She had gone to the dentist, and the dentist put a night guard in. Said, you need a night guard, you're grinding like crazy, and so forth. And because she was complaining about headaches and so forth. Once he put the night guard in, she ended up going into migraine headaches. And she'd wake up with one. And it's because the night guard wasn't fit properly. How many go to the dentist, and I'm going to make a whole lot of dentists that might be listening right now pretty angry with me, but nevertheless is the truth. And that little carbon paper, and they put it in your mouth, and they go tap, 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 grind, 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 because they want to see the high spots, and they go zip, 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 zip. First of all, they do it when you're laying backwards. That's not how you live. You live standing up. You live in at least a seated position. I drive my dentist crazy. I go in and say, no, thank you. I'll sit up or I'll stand up, but that's the way you're going to do it. It has to be done properly. But the real key there is to make sure that the temporomandibular joint is in position before you do anything like that. So anyway, this poor woman comes in, and she's telling me, what did take place? I said, when did it first happen? And she walked me through it. I said, bring your night guard in, but I don't want you to use it between now and then. So she comes back in a couple of days later, and I said, how you been feeling? She said, I've had headaches, but not like they were. Okay, get your night guard. I did a muscle test, and what I mean by that is we just test a muscle, and I had her put the night guard in her mouth, and I had her gently close on the night guard, and it weakened every muscle that I tested on her, every muscle, because it caused an immediate neurological distortion that was not normal, and that's what was triggering the crazy migraines. And it wasn't the dentist's fault. They just didn't understand. That's the way they're trained. But good neurological applications are critical to make sure that those things are done the right way. Or if they put a post in, or if they put an implant in, any of those things, they have to be done neurologically balanced in a way that they're not going to cause any distortions. So, there's a good dentist out there that we refer to on a regular basis when it comes to these types of things. And it's Soft Touch Dental. And, he's one of our sponsors for the program, but I'm very careful with who I bring on. And they do a good job. He's a graduate at LVI, Las Vegas Institute. And if you want somebody that's going to fit a night guard or a sleep guard or anything like that the right way, this is not a bad place to start. And look, that's just one cause, right? We talked about the blood supply from the neck, the vertebral artery that goes to the base of the brain, and it supplies the circulation to the back portion of the brain. That can give you your vomiting. That can give you your twinkle, twinkle, little light, the aura. That restriction of that blood supply that has been tight during the workday, and then at nighttime when you go home and you relax a little bit, all of a sudden that blood flows so fast to the brain, it causes that migraine-like headache. So migraine is what? It's neurological vascular, okay? It's a vascular headache. It's inflammatory in most situations. It's neurologically restrictive, but it's coming from something often that is mechanical. But it also can come from something that's what? Hormonal. It also can come from something that is you're exposed to in your environment. It could be that in your environment, there's noxious gases, off-gassing, if you will, that are coming off the carpet in your office or off the walls or something that's being pumped into the building. One of the things I do with patients who suffer with migraines that, they say, well, it only happens when I'm here. I said, do me a favor. Get a big old, like a Miracle Whip jar and clean it up so it's squeaky clean. There's no residual of anything. And before you come in, I want you to open it up and put it on a table in the room that you're in the most of the time. And so you get the airflow right through it, and then you set it up straight, and you put a piece of plastic over it, and you put the cap back on. I said, bring it in with you. Now, what we know electromagnetically, is that you can test any substance by doing a neurological muscle response. We call it applied kinesiological techniques. And I'll have the patient open it up and smell it and test the muscle. If it weakens that muscle test that was previously strong, or we call fully facilitated, guess what? There's something in that environment. We don't necessarily know what it is, but we know that there's something there. So we have to make some modifications. We got to fix the body so it doesn't continue to react and trigger. But we have to also change the environmental impact that's taking place. It could be in your house, it could be in your office, it could be in your car. In today's world, with all the electrical fields, the Bluetooth technology that's in our vehicles, all the, the data centers that are around, so we're seeing all kinds of craziness that are causing very types of headaches. Now, all migraines are headaches, but not all headaches are migraines. Some people say, well, I've got a really bad headache. It must be a migraine. Not necessarily. Migraines, remember, are much more severe. They're longer lasting. They involve all kinds of neurological presentations. The eyes change, the head pounds, the sensory perceptions go away. And we have to make sure that we understand the differentiating pieces so they can be treated properly. We've had great ability to modify migraine presentations, and in most cases, gone. So I want you to kind of take an inventory. When do these things happen? Are they major issues? Do they seem to affect one side of the head? Do you want to vomit and throw up with them? Is it, something that stops you in your tracks? That's often a migraine. Is there an aura, a prodromal that takes place? And that aura doesn't have to be an aura. It can just be a confusion state. It could just be a discoordination state, and it's building up. All of those things tell you that the nervous system is being affected significantly by that platform. Remember, March 18th at the Roselle Center in Fairfax, Dr. Zhang and I are going to go through step by step. These things can be resolved, my friends. Love to have you as our guest. And I want to remind you also, for any nutrient bases that you want to find, go to our website, go to rosellecare.com, go to Ageless Health Store. We're coming up to the end of the program for today. We got so much more. We're going to start touching on this and other topics as we go through. Let me know what you want to hear. Let me know what I can give you information on. You can always reach me. Just go to rosellecare.com and ask me a question. I'll send you an answer back. I promise you I'll do it. Anyway, we're here on an ongoing basis every Sunday, high noon, 12 o'clock in the Washington metropolitan area, and wherever you happen to be listening to us and picking us up. And the reason, and only one reason, is simply this. I love you all. You have a great Sunday. Enjoy your day. We'll see you next week. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Headaches and Migraines on Wednesday, March 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.